learn Kiran Madurwa for introduction of Dr. Ashish Chauhan.
Good evening, everyone.
Very good evening.
Yeah. Dr. Ashish Chauhan, MBBS MD, Internal Medicine. He's a senior consultant specialist in diabetes and an adult immunization expert, Apollo Hospital, Hyderabad. Specialized training in adult immunization, fellowship in diabetes under aegis of Dr. Nihal Thomas from CMC Vellore. He has been an active speaker in various media platforms. Health Talk on national Hindi channel, Subh Sandesh, where he has interviewed Padma Award Dr. D. Nageshwar Reddy, Dr. Sunil Chandy, and Director CMC Vellore, and Padma Shri Dr. Umesh Bharti. How to avoid law, suits, and stress management for doctors have made him popular globally. He is actively engaged in teaching students from medical fraternity. His blessed lectures have been well liked by medical students worldwide as well as nursing graduates. Dr. Ashish Chauhan is an avid reader and a socialite where, along with Olympian Saina Nehwal and Gagan Narang, he has spearheaded vaccination camps among orphans, along with countless food distribution camps. His organization, Nath's Learning Forum, works in the field of academics, where through collaboration, medical, nursing, and other educational institution has been enormously benefited. Thank you.
Thank you, Dr. Thank you, Loan Kiran. Now, I would like to invite Dr. Ashish Chauhan for his message on prevention of various types of cancers.
Am I audible?
Yes, sir.
Okay. Good evening to everybody, and it's an absolutely delight to be here. And yes, we do get adjusted to change as and when the need arises. I would want to do a very quick session in 5 to 10 minutes so that we have enough of it audience and we do not miss out of what Vijay Karan Reddy has to talk about the childhood cancers, because yes, children are the future of our country and generation we need to focus on. I would request one single point, the point to everybody is to keep a pen and a pencil, and even though the session is being recorded, there are a couple of things which you need to keep it to your mind, and this is needed for your children, for your elders, and for your the Lions Club as such. First and foremost, congratulations to Chetna ma'am for organizing this blessed talk. This is the need of the hour. At this time, we have a huge number of patients of cancers which are coming up, and none other than Vijay is one of the best people to address that. Almost 200 ladies die every day with cervical cancer. Yes, 200 every day, 180, which is a scary number. The numbers of cancers are going on and on in the data in this present era. And when we say cancers, definitely even children are getting kind of getting engulfed into the same panorama and spectrum. So what should we know? I would want to understand when we say childhood cancer, we not only mean just born or 5 or 10, we definitely mean even the teenagers, we definitely mean the even adolescents and everybody. I would want to give a generic talk which should be involving everybody irrespective of age, caste, creed, and religion. I like to leave a acronym always, and I would want to do that at this time as well. Number one is C is the spelling of cancer is Cancer. C is for cigarette smoking, and to understand that every cigarette takes away your 11 minutes of life, and that needs to be addressed, especially because there is a peer pressure which is making a lot of people to start smoking and tobacco consumption. And that is what I would want to remind everybody. Not only the cigarette causes lung infections and the cancers, cigarette causes cancer of every single part of the body. So try to stop the initiation of this act, and we all should be watchful about it. A is for age. As the age progresses, um, the people do get high chances of getting cancer. If you are growing old, definitely you must know what kind of possibilities you have it. Not only the age, A is also for awareness. It's important that we are aware of our family history. If somebody in our family has got a cancer, our chances of cancer is high. So C is cigarette smoking, A is age, A is awareness. That is what we need to know it. N is we have to say no to few things. No to alcohol, because alcohol causes gastrointestinal cancer and liver cancers. We have to say no to unnecessary radiation. We all kind of get very much comfortable going for chest x-ray and CT scan even when it is not needed. I have had tons and tons of cases where they do the investigation themselves and they come. X-rays and CT scans and other radiation things are not something you should play around with. Definitely let your doctor decide it what is the right thing for you. There's no point telling ki I told you we will do a CT scan and then we will go to doctor, in order to just save second visit to the doctor and trying to save one fee which you have to pay to the doctor. Get investigations only and only as per the doctor's um, advice, and definitely any other kind of radiation you need to be staying away from. Mobile addiction is something which we all need to understand it. We are living in a world of commercialization. Can these mobile phones and excessive use cause some kind of issues in the future? As per our experiences, there is high possibility. We have to understand that we limit its use and definitely keep it away from our body. Keeping it in our upper pocket, which is near to the heart. Can it be the reason for the increased number of heart attacks? Probably the answer is yes, and not that every time you will get answer for everything. Keep cell phone away from your head, and definitely try to keep it away from your sleeping side next to the bed. No, you must keep it away. So understand, any kind of radiation in long term will have damage. When we know that there are a few places where there have been exposure of radiation and the possibility of radiation is there, we better stay away. Please check, even there is a radiation from your cell phone also, and there is a way you can check whether your cell phone is safe or not. There is SAR value which you need to check it out. I'm very much sure there are a lot of IT people out here who will tell us. So no to smoking, no to alcohol, no to radiations, no to smoked fish. Too much of spicy food will give the chances of high possibility of intestinal cancer. We are very, very comfortable in having Zomato and Swiggy. I'm not against them, but we have to understand, ati ka bhala na barsna, ati ki bhali na dhoop, ati ka bhala na bolna, ati ki bhali na choop. If we are going to have a 3 times a day food coming from Zomato, we're going to take too much of processed food. We are putting our lives as well as life of our children at risk. CANCER, consanguinity menorrhagum. If you are going to get married within your own family members, chances of within the blood relatives, chances of cancer are high. Within yourself, with your children also, it's always get better not to get married in the blood relations. There are a lot of diseases which transfer, and because of the dominant genes, you can, if two people who got recessive genes, and if they get married, there is a chance the child can have the disease even when parents are only the carrier. So consanguinity menorrhagum, we should avoid it. E is exercise. Please send your children to exercise. Please send them for games, because yes, the heart attacks are increasing, cancers are increasing. Why exercise is needed? Because obesity causes cancer. For ladies to understand, and especially they need to tell, obesity causes the breast cancer, obesity causes endometrial cancer, and there are many cancers which are connected. Vijay can highlight those topics like pancreas and liver. These all are connected with obesity. We have to understand obesity does not run in the family. This is stuff which I would want everybody to know. It obesity does not run in the family. The problem is nobody runs in the family. Yes, running itself every day, exercises are very, very important. So exercise daily. You want to live for 100 years, 100 minutes of walk per day, 20 to 40 minutes in morning, 20 minutes afternoon, and 40 minutes post dinner walk is a must, which we all need to understand it. I would be very, very happy if everybody writes these points. How do you live for 100 years? 100 minutes of exercise per day. 100 seconds of breath holding exercise per day. Breathing exercise, which should be able to hold breathing for 100 seconds. 100 visits to your doctor will keep you alive for 100 years. We are scared. We try to avoid doctor because doctor will write investigations. My dear friends, Mrs. Saroj, Ramesh Sahab, doctors are not magicians. They are doctors. They are scientists. They follow the science, and they would require reports to be done. And those reports can help them to decipher what is the possibility. Finally, R is for rest, R is for rehydration. I would want to tell you, we all need to, if you have a possibility of lung cancer, or if you have a possibility of, gastric cancer, we need to have a repetitive investigations to be done. Please understand, cancer is like a terrorist. Like one search, can we tell that the whole building does not have any terrorist? No, we need to do the multiple, search, which the people do it for the terrorists, or for nabbing a negative element in society. Like this, we also need to have multiple searches and multiple investigations to be able to come to the right diagnosis. Cancers are curable, cancers are treatable, and above all, cancers are preventable. Who can prevent cancer? Only and only a very much empowered citizen. So it is a responsibility of a blessed, club like that of Lions Club to understand that yes, it's all about giving the right information to the right time to the right kind of people. I would finish my talk only with four eyes. You do not want anybody around you to be sick. You do not want anybody to be unhappy. You do not want anybody to be unhealthy and crying. Follow the four eyes, and this session is one of those eyes. Dissemination of right information. There's infodemic, people spread the wrong information. So, right information. Everybody should have right insurance. Please do not try to think you will get the best treatment by having the less amount of money. No, you definitely require a right kind of insurance to help you out at the right time. Right investigations, which will be decided by your doctor at the right time. It has to be done. So investigations, insurance, information, and finally immunization. There are two immunizations which prevent cancer. Number one is HPV liver, hepatitis B liver, and number two is HPV, which will prevent the cervical cancer, anorectal cancer, and oral cancers. I salute to Lions Club, especially Chetna ma'am, and all of you people who have taken time to join us out. At this time, I would want to put my mic down. I'll be very happy to take any question on the chat box. I am Dr. Ashish Chauhan, living with the mission that I would need your help to keep hospitals completely empty, especially the ICUs and emergencies. You and me can keep ICUs and emergencies empty if you reach out to the doctor early in time. The biggest thing which I'm very much sure Vijay Karan Reddy, one of the very leading and budding cancer specialists, will talk about it is what is a big difference between Western culture and Indian culture. In Western, 80% of the cancers are detected in the early stage. In India, 80% are detected in the last stage. And when you detect a cancer in the last stage, not only that the people will die and there is no treatment available or very, very costly treatment available, it turns out that you will have a result for which you will be telling that doctors are very commercial. I'm very much sure come to us much earlier in stage 1 and go back with 100% survival rate. That's the kind of technology which we have it. I am Dr. Ashish Chauhan, consultant physician and diabetologist from Apollo Hospitals, practicing in Secunderabad as well as Ethan's Clinic, Garden Towers, Masaptang, and Nanak Ramgoda at Live Life Clinic, with only and only purpose in my life. Can I keep my people, my community, my beloved Indians out of hospital? And that can be done scientifically if only every lion member gets together and takes this task. That yes, we will assure that everybody around us gets the right kind of information. And once this video is ready, I would want you to share this video. I will be very happy to leave my number 8106127475. Anybody can send me a WhatsApp message 24/7 for any kind of information at the right time. With these few words, I thank each one of you for the great participation. I'll just take one question because Vinod Kumar Saab has put this question. Does diabetes have anything to do with cancer? Very, very great question, Vinod Saab. Diabetics have high chances of getting cancers, liver cancer, pancreas cancer, kidney cancers. So diabetics do have high chances of cancer. It's a very good question. So you need to control your sugars. Every diabetic should have a fasting sugar around 100, and every diabetic should see his doctor 1 in 100 days on the regular basis. Please do not use 3 words in front of your doctor if you want the right opinion, if you want to live longer. Do not use the word ausrama. Is it needed? Number 2 word which will kill you, even the right doctor cannot save you, is nenu anukunna. I thought so. The 3rd word is kada, aim ledu kada. See, these are the 3 words which confuse doctors. 99% of the doctors are, I am not too happy to say, they are bad communicators. They will end up speaking what you want to hear. They will not, all the doctors are like poor husbands. They will say yes to whatever their wife wants to listen to and hear. So the doctors will say what you want to hear, and that will be a wrong advice unknowingly when you put the words into their mouths. I hope I have done my job. I would want to take any questions, or I'll request my very beloved friend, Dr. Vijay, to take over. Any questions from Challa Srinivas Reddy Saab, Lion Sardar Saab, and Saroj or Bhavesh or anybody?
Thank you so much, Dr. Ashish, for very useful information about prevention. Anyone wants to ask any question? Is there anyone? Not seems. Okay, now I would like to call Lion Bhavesh Jetra to introduce our speaker, Dr. Vijay Karan Reddy. Bhavesh.
Yeah. So good evening, everyone. I would take this opportunity to introduce Dr. Vijay Karan Reddy. So he is a national gold medal winner at AROI for his research in head and neck radiotherapy. He has done MD from Adyar Cancer Institute, Chennai. He is also a fellowship in head and neck oncology, UCLA, USA. He has fellowship in pediatric oncology at MD Anderson Cancer Center, USA. Fellow of AROI in Neuro-Oncology at Christie Hospital, Manchester, UK. European Society Certified in Medical Oncology. Clinical Fellowship in Proton Therapy at Apollo Proton Center. Fellowship in Advanced Radiation Techniques at University of Heidelberg, Germany. He has also co-authored national publications in neuro and head and neck oncology. I welcome you, sir, Dr. Vijay Karan Reddy.
Thank you, Mr. Bhavesh. Thank you for the wonderful introduction. First of all, I would like to thank Mrs. Chetana and Dr. Dr. Ashish sir for giving me this opportunity to be here. Pediatric cancers are not very, commonly covered. People always keep talking about breast cancer and gynecological cancers, which of course are more common, but it's just only that you don't hear about pediatric cancers so much, but the incidence is actually increasing. And India itself, about 80% of the world burden of pediatric cancers is in India. And the cure rates, when you compare it to the Western world, is actually much lower in India. The only reason it's not coming up in the list as much is only because of, there is no documentation, there is no registry. Registry has just now started, so hopefully it will keep, pushing up the list in the cancers that we need to be more aware of. So thank you, Ashish sir, for covering cancers and the steps to prevent cancer so eloquently. I'll also start my presentation with a general talk on a few slides on what cancer is and how we can prevent it and fight it, and then I'll move on to the pediatric cancers. I hope you can see my screen.
Yes.
Okay. So good evening, everybody. I'm Dr. Vijay Karan Reddy. I'm working as an oncologist, consultant oncologist in Apollo Hospital, Jubilee Hills, Hyderabad. So now we all keep hearing this word cancer, cancer so often. What exactly is it? Just to give you a brief. So every cell in our body has a propensity, has a tendency to divide. That's how we grow. Every cell, every organ divides and grows. So there are specific genes in our body which actually control this division, tell the cell when to divide and when it should stop. So when there is any mutation in any of these genes, this mutation can come to you by birth, or this mutation in the gene can happen anytime during your lifetime, which we talk as the risk factors, which is smoking or bad lifestyle or obesity or whatever it is. So any of these factors can cause this mutation in the gene and cause uncontrollable cell division, which is basically called cancer. Again, in cancer, there are two things, that is benign and malignant. So what you usually call a tumor is what is benign tumor. That is uncontrollable division of cells only in one particular area where we can just operate and remove. It is not uh, hazardous to life. It does not need any further treatment, does not spread to other parts of your body. But when it comes to a malignant tumor, the tumor grows in its area and also invades in the surrounding tissues. That can spread to other sides of the body. So whenever we say cancer in general terms, we usually refer to malignant cancers, malignant tumors. So the radiations, chemotherapies, stage of cancer, all these come under when we are treating malignant tumors. Like I said, every cell in our body divides. So every cell in our body has a propensity to develop cancer. There is no age predilection in. It's not that young people don't have cancer, older people don't have cancers, more cancers in men, less cancers in women. There's nothing like that. Everybody is, prone to get cancer. So just to make it very simple, Ashish sir also has given you a mnemonic on what all things that you need to avoid. So what you need to understand is any long-standing problem that you have in your body, like if it is a cough which is not going, if it is fever which is not controlled with medication, you have some abnormal bleeding somewhere, you have some mole or a swelling somewhere on your body which is growing, that it could be on the breast for a breast lump or anywhere else in the body. Unexplained weight loss, you feel lethargic, unexplained weakness, laziness. So any of these which are not taken care of with regular medicines, you need to think that you might have cancer. It could be a girl or a boy, or at a younger age or an older age, but you need to be aware that even if it is a child with continuous fever not being controlled, you have to get a blood test done and see if the child has leukemia. Like Ashish said, many of the cancers can be easily prevented. You don't need to do any special tests or any special thing that, to fight this dreadful disease. Very simply, stay away from smoke, maintain a healthy lifestyle. Everything that goes into the body, you should be aware of. It could be food, having a balanced diet, more of fruits and vegetables and less of meat, less of red meat. Ashish sir has also mentioned what type of food is actually good for you. Even if it is the air that you take in, be very aware of the surroundings where you're living, where you're working, whether you're doing physical activity or not, whether you're overexposed to the sun or not, if there's any pollution around you or not. Any of these factors can ultimately lead in some way or the other to cancers. The main reason why the incidence of cancer is growing up uh, is because of the change in lifestyle, because of the processed food that we're eating. We don't know where the food is coming from. We're always eating outside. There's rapid urbanization development going around in the cities, always some construction going around where we are living, where we are working. There's constant increase in traffic with very high pollution. Any of these factors you have to be aware of and try to cut it down as much as possible. Within you, tobacco, smoking, whether tobacco or non-tobacco, and alcohol, obviously, both of these in a combination are a very high risk of get you a very high risk of cancer. But at the same time, you should also be aware of the other side of it, that it doesn't mean that if you don't smoke, you don't get cancer. There are so many other factors which will, eventually can cause cancer. You have to be aware of all these things. Most common cancers in India right now, the latest list shows that breast cancer is the most common. Cervix and uterus are the third most common. Lung cancer is the fourth. Stomach is the fifth. Uh, Pediatric cancers come somewhere in the top 10 itself. Even ovarian cancer comes somewhere in the top 10 itself. Right now, the reason why we keep hearing so many things, so many talks about breast cancer, it's because it is so common. The incidence is such that 1 in every 8 or 9 women in India would be diagnosed with breast cancer during their lifetime. So that's how serious the issue is, and very, very important for us to know what to do and what not to do. So moving on to pediatric cancers, I can answer a few more questions about, in general, what cancer prevention and the screening tests that are available and what you need to do. You can ask direct questions later. I'll just briefly cover the pediatric cancers also, because that is what my talk is today. So pediatric cancers are about 1 to 5% of all cancers. 50,000 new cases are there every year. This is in India. India accounts, like I said, 80% of the world pediatric cancer burden. When you think of cancer, or we always go to looking at risk factors. Both me and Ashish have just spoken to you about what are the things that increase the risk factor. But for a child, he's not even exposed to these risk factors. But why is he getting a cancer? Unfortunately, nobody has an answer to it. Many of us might think that it is genetic. A child getting cancer means it is coming from the family or the parents. But you should know that only 5 to 10% of pediatric cancers are genetic. Most of them, we really don't know the reason for it. The reason why pediatric cancers are not being talked about or not seen up in the list is the lack of registries and awareness about the child. Lymphomas, these are the liquid cancers, both related to the blood and the lymph. Next comes retinoblastoma. Retinoblastoma is a tumor of the eye, cancer of the eye, seen in young babies as young as 2 to 3 months old to age about 10 to 15 years as well. The next comes brain tumors. Any of the brain tumors usually seen 5 years and above, very common in young adolescents. What are the symptoms of pediatric cancer? So in your child, these are some of the things that you need to notice and you need to be aware of. It's not just about child getting fever and you starting antibiotics. There are other things that you need to keep in mind. That's why this talk is very, very important. If you see that your child is pale, they're bleeding, unusually bleeding, bruising very easily, uh, he or she falls down, gets a hurt that doesn't heal but bleeds for a long time, or leaves a large bruise for a long time. If you see any lumps or swelling anywhere in the body, the evening, the child in school, and you see him unusually being very lazy, lethargic. Even in school, the teacher complains that he's not moving around much. Again, that is one of the signs. Unexplained weight loss is very, very common in leukemias and lymphomas. When you move on, like I said, retinoblastoma, white pupillary reflex is what you look at. Any common childhood cancers can also occur in the abdomen, which is a neuroblastoma or a Wilms tumor. In that case, abdominal swelling would be there. If it is a brain tumor, headache, vomiting, disorientation would be there. Limb or bone pain with a swelling at the edge of the long bones that is usually seen in sarcomas. Fatigue, lethargy, I've already mentioned, and dizziness comes with the CNS tumors. So I just listed out the common tumors and what we actually do, what you need to do to rule out cancer for them. For leukemias, the common symptoms are pale, easy bruising, and lethargic. Leukemias are basically any disturbance in the blood counts of the child. Think of a leukemia. So the symptoms would be, if the hemoglobin is low, they will be lethargic and pale. If the platelets are low, there will be easy bruising. If the WBCs are very high. That means it is, the child has some sort of infection. So how do you diagnose this? A simple CBC, that is a complete blood picture test, along with the peripheral smear, will give you an idea of whether the child would or would not have leukemias. Post that, if your physician feels that there is some abnormality in the peripheral smear as well, then you do a bone marrow biopsy to confirm it. Bone marrow biopsy is just you take out tissue from any of the bone marrow sites. Most common site is the hip bone that they usually take the bone marrow from, and test it for any abnormal cells, that is abnormal blood cells. Lymphomas, fever is very, very common in lymphomas along with weight loss. This is something we call B symptoms in lymphomas. That is, there are two types, Hodgkin's and non-Hodgkin lymphomas. In this also, child might feel the neck, legs. The diagnosis of this, again, with the CBP, ESR is erythrocyte sedimentation rate, gives a broad idea that there could be lymphoma brewing up in the body. Chest X-ray, because one of the most common sites of lymphoma is the mediastinum, is the center of the chest. So chest X-ray can reveal that. If chest X-ray or a CT scan can be done when the child has continuous cough or has shortness of breath, and ultimately you would need a biopsy. If any of these swellings or the chest, if you see anything in the chest X-ray, any of these tumors or swellings, a biopsy or a tissue should be taken from it to confirm what type of cancer it is. Retinoblastoma is again one of the very underrated, most common childhood cancers. That is the cancer of the retina of the eye. It is seen at a very young age group. We treat a lot of patients of retinoblastoma in LV Prasad Eye Hospital. So we see day in and day out how many cases are there, especially cases coming up. What you need to look for is a white reflex of the eye. So whenever you take a family picture, then you see that there's something called a red eye that you see for us also if there's flash falling directly into iris. So in very, very small children, also you see this white sort of a reflect that happens when you take a picture, or even when you put light on their eye, you see a white patch on the back of the eye. So when you see that, parents can easily notice it. Don't ignore it. Go and see an ophthalmologist immediately. They'll do a B scan or ophthalmoscopy scan, and then they can let you know if there is retinoblastoma. Coming to CNS tumors, depends on the location of the tumor in the brain. It can either cause headache, dizziness, vomiting, disorientation. Many common pediatric tumors also occur in the nerves in the brain. So you see some visual disturbances. If it is in the brain stem, then you see gait disturbances. The best way to diagnose any brain tumor is a CT brain, which is easily available. CT scan is available everywhere. When you want a more definitive diagnosis, then you can go on to a MRI brain. First, CT brain with a neurosurgeon intervention is what is primarily needed. Neuroblastoma is mostly appears, it happens in the abdomen. So again, you have weight loss, there's a swelling, abdominal mass, fever would be there. Abdominal imaging, whether it's an ultrasound or CT scan would be enough. Sarcomas are basically tumors of the soft tissue of the body. That is, it could be from the muscle or the bone. It can occur in any muscle or any bone in the body. Very commonly in the adolescent age, we see sarcomas in the long bones. That is the hands and legs. At the edge of the long bones, you see a large swelling or swelling on any of the arms. You could again suspect sarcomas. The best way to diagnose a sarcoma is, yes, first, of course, imaging. Second would be a biopsy. Imaging will not give you a conclusive diagnosis. It will only show you the extent of the swelling or the mass that you see visually, but you have to confirm what type of sarcoma it is. So how do we treat childhood cancers? The good thing about childhood cancers, God has been favorable to them in terms of cure rates. Compared to adult cancers, children tolerate treatment better, and also they're very, very highly curable. The drugs that we use for children also are very, very inexpensive. So what you should know that more than 90% of all these types of tumors and cancers are curable. Whatever treatment that they get has to be a protocol-based treatment, has to be by a pediatric oncologist for a particular type of tumor, the type of chemotherapy, the duration of chemotherapy that has to be taken is very, very important for two things. One is that cure rate will be very high if you give a protocol-based treatment. Second thing is for an adult, give them side effects and they can live with it post the treatment. But when it comes to a child, they have their entire life ahead of them. So it is very, very important that we keep that in mind, and the treatment is tailored keeping that in mind, and to keep the child on a very long-term follow-up to make sure that these problems don't happen, and even if they happen, they are dealt with it correctly is very, very important. So going to a specialist is very important, even though these cancers are very, very highly curable. So I'll enumerate the different types of treatment. So in cancer, generally there are three, right? There's surgery, there is radiation, and then there's chemotherapy. So in pediatric tumors, surgery, where is it used? Mainly in brain cancers, solid tumors, that is neuroblastoma or Win's tumor that happens in the kidneys or in the abdomen, nervous system tumors, that is neuroblastoma, like I mentioned, bone, that is sarcoma. So any of the bone or muscle tumors has to be the best and cure would be there only if any is listed here can be operated and removed properly and completely. Moving on to chemotherapy. So what exactly is chemotherapy? It is a systemic drug that is basically given through your IV, just like how a saline is given to you. So because chemotherapy is a systemic drug, it acts everywhere in every cell in your body. So apart from killing the cancer cells, it will also kill some of the normal cells. So many of the children that get chemotherapy, they have hair loss is one very common side effect. But again, this side effect is temporary. Once the child completes this treatment, they will get their normal hair back over a period of their life. Beyond this, during treatment, headache, nausea, headache, nausea, vomiting, feeling of weakness, loss of appetite, these are all common side effects that is also seen in adults. But children tolerate it much, much, much better. Like I said, it is a very protocol-based treatment, a very calculated, tailored drugs and doses are given. So, and the children have a very, very good, very strong immunity. So the effect of these drugs on them is very, very less. They tolerate it very well. This chemotherapy can be given in many different ways. Could be either by the mouth, into the vein, into the muscle directly, into the spinal fluid directly, or under the skin subcutaneously. So from surgery, chemotherapy is used to treat almost all pediatric cancers, and it forms a part of the protocol treatment in almost all pediatric cancers in one way or the other. Next thing that you need to understand, that extra thing that is there in children, apart from surgery, chemotherapy, and radiation, is a bone marrow transplant. This is very common. Recurred, we do a bone marrow transplant to give him the best possible chance of cure. What is bone marrow transplant? There are two ways which we do this. One is the autologous and the other is allogenic. So autologous BMT, they take the blood from the child itself, they extract the cells, separate the serum, freeze dry it, treat that blood, make sure that all the existing abnormal cells in the blood are destroyed, whether with chemotherapy or radiation. Like you see in the picture, this blood is irradiated, the body is irradiated, the child goes through a very high dose chemotherapy and then reinfused into the cell. The fresh bone marrow, fresh cells are reinfused into the body. The same thing when you have a donor who donates this particular type of blood which matches with the patient, and you do the same process with a donor, it's called allogenic bone marrow transplant, which is better when to get pediatric oncologist, depending on the type of tumor, the risk stratification of tumor, the chance of it coming back, and other factors. So bone marrow transplant is used to treat leukemias which are high risk or have relapsed, high risk neuroblastomas, lymphomas, and also germ cell tumors. From chemotherapy, bone marrow transplant, moving on to radiation therapy. Radiation therapy machine is somewhat, it looks like this. It's basically X-ray treatment. It is a local treatment, unlike this chemotherapy, which is systemic treatment. It is usually in pediatric tumors given as an adjunct treatment after the surgery is done, after the tumor or the cancer is removed, then you give radiation to prevent it from coming back. In certain situations, it is also used as an alternative to surgery or to reduce the size of the tumor and make it more amenable to surgery. So radiation therapy is used in soft tissue sarcomas, in bone tumors, in brain, eye tumors, if a little higher stage, stage 2, stage 3 lymphoma. Apart from the chemotherapy, we also give radiation. Even in leukemias, as a part of the bone marrow transplant procedure, we also radiate the entire body of the child with radiation to order to sterilize their entire bone marrow. Moving on to the newer treatments, again, targeted therapy is something that has come in after chemotherapy in the recent years. Targeted therapy also forms a part of the protocol for some of the leukemias and lymphomas. What the difference between a chemotherapy and a targeted therapy is, the targeted therapy acts on a particular mutation or a gene which is present in the tumor, depending on the type of cancer. So it will act directly on the tumor cells. It does not act on the normal cells. So the side effects that come from the targeted therapy are very, very few. Even though, the next question that you might ask is, when the side effects are few, why are you not using this instead of chemotherapy? Chemotherapy is still very the backbone of many of the protocol treatments. Now, targeted therapy as a consolidation, as an added effect, is given along with chemotherapy in a few cases. The other indication for targeted therapy is when the cancer has recurred, chemotherapy is not working, or as an adjunct treatment to prevent recurrence. Next comes immunotherapy. There's a lot of buzz about immunotherapy last couple of years. Even the Nobel Prize in Science was won by the doctor who brought the use of immunotherapy into cancer. So what exactly is immunotherapy? Chemotherapy, like I said, is a cytotoxic drug. It is a chemical that you're injecting into your body. Immunotherapy is also given in a liquid form, given into your blood. But what it does is it only potentiates your immune system to fight against the cancer. So there are certain signals on a cancer cell which prevent your immune system to grow. It will suppress your immune system. So what immunotherapy system to act faster and fight against the cancer cells. However, again, even though the side effects is compared to chemotherapy are still less, immunotherapy is slowly right now coming into the front line. However, chemotherapy is still the standard of care and the frontline management in many of the cancers, especially pediatric cancers. When I talk about newer treatments, we have to talk about proton therapy. So we spoke about immunotherapy and targeted therapy. Now, in terms of radiation, the latest treatment is proton therapy. So as simple as this picture depicts, X-ray treatment is usually what the usual radiation that we give. Like I said, it is local treatment, but when you're treating in pediatric cancers, a lot of normal tissue also gets a lot of radiation, how much ever we target it. Because of this, even adult, it's not a very huge issue. But in children, when they have a long life ahead of them, there are a lot of side effects that can be seen. Anything from developmental abnormalities to hormonal abnormalities, etc. So normal X-ray radiation will pass through the body like this. So even though this is the tumor and we target 95% of the dose to this tumor, there will still be spillage of a low dose around it. In this example, there's a lot of spillage that is going to the heart, even though that is not our target. But when you do proton therapy and you want the dose to be delivered here, the protons will come and deliver the entire dose within the tumor. It does not go anywhere around the tumor area, anywhere around the normal structures. So proton therapy was introduced into clinical practice as a standard of care initially for pediatric tumors. Now it is available for all types of tumors in adults as well. But it was first used in pediatric tumors for this specific reason, because there are no long-term side effects. The other thing is with radiation, get a cell during radiation. With proton therapy, that probability and chance is also close to nil.
Good evening, sir.
So these are all the side effects, just to list out, that can be caused because of the chemotherapy that a child receives. They can affect every cell in the body. All these could be long-term side effects. However, if they are monitored properly and handled and managed correctly, the child can still have a normal life, close to normal life. The take-home message: incidence of pediatric cancer is increasing. Is very important for all of us to be aware and not ignore the early signs and symptoms, which are as simple as a child getting a fever which is not resolved, losing weight, feeling lethargic. Very common symptoms which are usually overlooked and ignored. Most common in childhood are leukemia, followed by leukemias, lymphomas, followed by brain tumors. they are very highly curable. That is the good thing about pediatric cancers, that even though they are affecting our children at a very young age, they are very, very highly curable, and children tolerate the treatment also way better than adults. Early detection is the key. Parents have to be aware, and pediatricians themselves also to be aware that they should look and consider that the child might be having leukemia, lymphomas, and think in that direction and not ignore it. Best cure rates possible when they're treated by a specialist pediatric oncologist. So having protocol treatment is not only important to get the best cure rates, but also very important that the child can have the closest to normal life possible after the treatment. Thank you.
Thanks a lot for the wonderful presentation, Vijay. I will be very happy to have the PowerPoint for my other sessions. Really enjoyed listening to every single bit of it. Any questions? I'm very much sure कुछ भी चीज by any chance नहीं समझ में आया है आप पूछ लीजिए. There are these medical terminologies which we have used. It's not easy and it's fine. It's better to ask now rather than get confused. So you will be helping somebody to save their child's life. So over to Chitna ji and everybody else if there's any question which needs to be addressed. Thank you.
Yes, anyone if wants to ask any question, please welcome.
Any question or any general information that you're looking for regarding cancer also, I'll be happy to answer. Right now, breast cancer incidence is, increasing greatly. Like I showed, it is the most common cancer right now in India and in the world. So for breast cancer screening, what needs to be done? Every woman from the age of 40 years of age has to get a yearly mammogram done. And apart from mammogram, a simple self-breast examination at home once a month is also very, very helpful. It's only that you have to be aware anytime that you see any abnormal changes in the skin or in the nipple area, or you feel a lump in your breast, please don't ignore it. Please don't think that it will go away. Make sure it's as simple as getting an X-ray done. You just need to go and get a mammogram done. You don't even need to show it to anybody. Go to your gynecologist or just go get a mammogram done, and that itself will be good enough for you to know. It is better to face it and deal with it. The entire treatment would be only for about 4 to 6 months. Everything, surgery, radiation, chemotherapy. But if you ignore it, then it will be a lifelong problem, and it could be a life risk also. All the side effects that of treatment, again and again, I'm saying they're all temporary, they are manageable. Your oncologist will give you specific precautions, instructions on what you can do. Your treatment also is the dose of treatment, the area of treatment is tailored specific to each patient. It is not that we just write a paracetamol for everybody. So for each patient, the dose, the protocol that we use, the drugs that we use is tailored for each and every patient. So we make sure that it is as comfortable as possible for you.
Doctor, what is the sign of prostate cancer?
Prostate cancer usually it's very common in elderly men to have increased frequency of urine, that you have to get up in the night to pass urine. So the simple way to do that is to check for prostate cancer is you get an ultrasound done of the pelvis, and you get a serum PSA. It is a tumor marker, is very, very sensitive to prostate cancer. Any changes in your urinary habits, that you have difficulty in passing urine, there is urgency of passing urine, there is increased frequency of passing urine, without your passing urine without you knowing. So any of these symptoms, just get an ultrasound and a PSA done.
Okay. Thank you.
हाँ साहब, झा साहब
बोलिए।
आपने एक क्वेश्चन पूछा था.
हाँ, हमने पूछा था.
अच्छा, बीवी की डर से अगर सुसु निकल जाना is very common. That is not a sign of prostate cancer. That happens to every poor husband. Vijay, I'm very much sure people would want to know
Yes.
self-examination of breast. When do you do it? Because related to periods, will you please enlighten?
Yes, so during periods, it's usually, prefer to avoid doing a self-breast examination. Prefer to do it after your cycle is done, because during periods itself, the breast undergoes a lot of changes. It can It might be painful, it will become more dense, so it will become hard for you to feel any lump if it is there. So I would suggest that you do it at least once a month, but away from your menstrual cycle.
Vasudha ji, you have asked, will biennial lump reoccurs after surgery? I think you need to speak it out. What do you mean by that? Vijay, would you want to answer? You also want to have a clarity.
Yes, sir. I think she meant benign lumps, sir.
Okay, yes, go ahead.
Yes. So see, the usual lumps that you find in the breast, 90% of them are benign. So you
Yes.
usually don't have anything to worry about. And like I said, again, just a mammogram is enough. You don't even have to put a needle in that area. Mammogram will tell you whether it is a benign, if it is a benign transforming into a malignant, or it is a malignant. So once you do a mammogram, then you go to the next step. So many of these fibroadenomas, the chance of them changing into a malignancy is actually very, very low. That is less than 5%. So when there is a benign lump and you remove it, the chance of becoming cancer later is very, very less.
So by benign, we mean non-cancerous lesion?
Yes, sir. Non-cancerous lesion.
Non-cancerous lesion, and malignancy is what is cancer. Malignancy,
Yes.
cancer, and carcinoma are three same words.
Yes.
Yeah, hello, doctor. I have two questions.
Your
Yes.
introduction, please.
Yeah, I'm Sridhar. So
Please
first
tell me.
question, first question is, are these cancers occurring mostly from last 50 or 100 years? And the second question is, do animals also get cancers or only humans are affected? Thank you.
So cancers have been there for years immemorial, for hundreds, thousands of years. It is not something that has come right now. It has been identified accurately over the last 100 years. The incidence right now is increasing more and more. Like I said, is because of the lifestyle. But in existence, cancer by itself has been there forever. Initially, even after they identified what cancer is, it was a very clear thing that if it is cancer, it has to be operated. If you cannot operate it, it is a death sentence. That is only one line that was related to cancer like 100 years back. Even when you look at the different types of treatment that have come in, radiation has come in only in the 60s and 70s. Chemotherapy has come only in the 80s and 90s. Targeted therapy only in the 2000s. So as the incidence is increasing, our artillery and our number of weapons are also increasing. So we are able to fight it. What was the second question? The cancer also happens in animals. So it's not that it happens only in women, it's just that we don't hear about it and it is not documented. People don't usually evaluate it as much as they do in a human, but it does occur. And for dogs also, the treatment is the same. They do get chemotherapy, they do get surgery done.
And another thing, if I can add, is now we are able to detect more because of early detection and because of our technology is improved. We have a very good engineers and technologies who are helping us out to detect cancer before we lose a patient to the cancer.
Yeah. Yes, sir.
We are able to detect it much faster and earlier.
Correct.
That's
Faster,
all.
earlier, things like having a Zoom is enabling us to spread awareness also easier to a larger number of people. The other thing is, in India, the cancer registry also started recently. Over the last 5 to 10 years, they're very intensively working on having a proper cancer registry for each state and the country. So that way, when you get to, have more documentation, you have more numbers to work with, then you can plan your screening programs, prevention programs, whatever it is government enabled can be planned in a much better way.
Dr. Vasudha Rani would want clarification that lump repeats again after surgery. Will lump
Yes, sir.
repeat again after surgery?
If it is a benign lump, it will not repeat. If it is a malignant lump, it depends. If it is a stage 1, then usually does not repeat. The patient might be kept on some hormonal therapy, but any higher stage than 1, if it is only surgery, there is a very, very high chance that it will recur. The patient would need chemotherapy or radiation after the surgery to prevent the recurrence from happening.
I would want to leave one message with all my friends. We have a good technology. and the treatment which we provide is the cheapest in the world. The only problem is the cheapest treatment in the world, we find it very, very costly. And that is a bit kind of a misery which we have it. Everybody needs to have a good amount of insurance with whichever company you can take it with, private. And actually, in my personal opinion, everybody should have two insurances. One is from the public and sector, and one from the private sector. Not less than 25 to 50 lakhs or above also is needed, and which is very, very cheap if you actually get into the system of insurance earlier. Then it doesn't cost as much as it costs in the Western world. Like in Western world, it costs almost 10 times than what we pay here. It's as less as 10 to 100 rupees per day, and that's it. Just 10 to 100 rupees per day, you can have an insurance of almost 50 lakhs to 1 crore. But it's just that when we are not sick, when we are healthy, we don't like to focus on it, and then we crib in the last moment that corporate hospitals or all the centers are charging more. This is just a general information which everybody should have it. The 7 S's which will kill you and me. Number 1, CAD, heart attack. Number 2, CVA, paralysis. Number 3 is cancer. Number 4 is CKD. Number 5 is casualties, that is road traffic accident. So all the C's are there, and cancer is one of the number ones, especially if you're gonna live longer. So you must make enough investment for your cancer treatment in future. Any other questions, please?
Doctor, is this pediatric cancer more in the rural area or in the urban, doctor?
Vijay?
Yes.
This
So
question
as far as what we see, it is more common in the rural areas.
Is it? I was thinking it'd be urban because of change of lifestyle. Why
No,
is it
so
rural only because they are not aware? Is it because they are not aware?
they are not aware. And
I guess.
see, the incidence in general, right now, like I said, it is increasing. It was not as much before. Awareness and documentation was not there. That's why we are seeing more and more number of cases. And yes, in rural population, awareness is very low. So we see many of them coming to the city looking for treatment. However, see, many of these government institutes do have free treatment for leukemias and lymphomas. So they take care of the entire treatment for free.
Okay. What I would like to know is eager to that we as Lions, how can we reach out to the rural people? I mean, how do we make them aware? Like give more
So,
talks in separate each village or something? What
so
will help them?
the only way to increase awareness is to directly talk to them, arrange talks like this with a certain group of people, get 20, 30 people together and interact with them and let them know. Because unfortunately for pediatric cancers, there's no screening test as such that we can
Yes.
just test everybody and it's not that
Can I
it is genetic
intervene here?
also.
Yeah. Thanks, Vijay, because that's a clear-cut idea. So that is where the Lions Club comes into the scene. One simple question, and I would want an answer in the chat boxes. Do you think you have learned something new which is helpful for your family, for your own community? If the answer is yes, then I would want each one of you, to take your laptop and go to the rural area where there is a good connectivity and open up laptop and when these such kind of sessions are going on. साहब अपने देश के लिए तो जो कुछ भी करना है, समाज के लिए अपने जो कुछ भी करना है, उसके लिए 2 कदम तो एक्स्ट्रा चलना पड़ेगा. And Lionism is all about taking that one step extra for making an impact in the society. So thanks for that lovely the input which Vijay has given, that we cannot screen for childhood cancer, and that's why the 4 I's which I have scribbled: information, investigation, insurance, and immunization is the must as about the existing structure which we have it. Any input from anybody else, please?
Doctor, does immunotherapy help like in cancer treatment that you don't lose hair and all that? Like, I mean, the
Yeah.
side effects of radiation, does immunotherapy help in that?
Yeah, so in terms of side effects, the side effects for immunotherapy are much lesser compared to chemotherapy. So the hair loss that you see in chemotherapy is not there in immunotherapy. But right now, for example, if you take breast cancer and you getting a surgery done, and according to the stage and tumor, you require chemotherapy. So in that situation, immunotherapy still not has replaced hasn't replaced chemotherapy. Chemotherapy is still the primary curative treatment. Immunotherapy is right now present in stage 4. Eventually, in the future, we might see it that is used instead of chemotherapy. But as of now, it is still in the vaccine.
Thank you,
Side
doctor.
effects are less, but it's not a curative treatment right now.
Good evening, doctor. This is Shilpa.
Good evening. Please tell.
Yeah, actually, what I have a doubt is why do we give saline when a patient is admitted in the hospital? What actually is the reason for giving saline? And one more thing, instead of injecting, instead of giving so much of burden or stress to the hand, why don't it be given in the form of liquid, either in drinks or something? Is that not possible? This is my doubt.
It
Can you please
Yeah.
clarify?
So the first part of your question, I think Dr. Ashish would be a better person to answer it about saline. The second
Okay.
part of your question, why we do need to do it through IV and why can't we do it orally? There are a few drugs which are given orally, but the problem is the only issue is the constitution of the drug. That particular molecule, whether it can be converted into a liquid form or a tablet form, that is the question. So as much as possible, there are a lot of drugs which in the recent past also from injections we have turned it into either tablets or syrups, but it is not possible with all the drugs. It is only
Okay.
question of developing a particular molecule in that form. If it is not
Mhm.
possible, then we have to stick to the IV. Whenever
Okay.
you go to a hospital, why do they give saline? I think Dr. Ashish would be a better person to answer that
Okay,
because he
five,
sees more
six
the
answers
details.
for that. I hope you will be able to get your answer sticking to that one. Why do we give injections? Because that has got 100% bioavailability.
And
When you're
I'm really
using,
sorry to interrupt in the middle, but it is a little very difficult for infants or the senior citizens. Oh, why don't they like instead of giving saline, why don't they opt for the second option if it is available, if it is possible? Sorry to you can continue, doctor.
yes, no, Shilpaji, that's what I was trying to answer.
Okay,
Say
okay.
it's a very simple thing. Is good. Every behind everything there is a reason for doing that stuff. The
Mhm.
bioavailability, when we give injection, the 100% of the medicine goes to the blood. When we
Okay.
are giving it through the mouth, now 50% will go away from the intestine, from your urine and from your potty and stools. That's number one. Number
Mm-hmm.
two is in when we give through the mouth, there is something called as acid, which is there, which kind of deneutralizes, it neutralizes whatever you give. So suppose like insulin, there is no oral insulin available in the world at all. The time you
Okay.
take insulin, the time it goes to the touches the HCl or the acid in the tummy, it immediately becomes absolutely like a water. It does not work at all. So there are reasons for doing that. So if you are giving there are different ways. So the bioavailability is 100%. That means the drug is 100% available for use by the body through IV injections. When through the mouth, it is not present 100%. Second part, when you are sick, your absorbability also decreases. So you will have a lot of nausea and vomiting. So when you give an injection, you know that the drug is going inside the body. When the absorbability has decreased, so normally only the drug will get absorbed 50%. So you're losing 50%. And when you are not well, when you're having vomiting, say dengue season, you're having vomiting, whatever medicine we'll give it, you will vomit it out. Rather, medicine itself will trigger you to have a vomiting. So we don't want you to make situation unpleasant, and that's why we give the injections. Last but not the least, uh, uh, and this is a practical answer. Uh, in majority of the insurance agencies, they believe that if a drug has to be, if patient has to be admitted, then only injection have to be given. Otherwise, they do not consider that the patient needs admission. So there comes the issue of whether the person requires hospital admission or not, and it will get cancelled by the insurance agency. I hope you understand. So they say very simple, and this is a commercial reason patient did not require admission at all, and that's why if patient can take tablets, then why are you admitting the patient? So that is another point of view, which is a more of a other reason, practical legal reasons rather than the clinical reason. Clinical reason is by giving injection, it reaches faster, it has a faster effect, and it is meaningful, and lesser dose can be given. For oral, we have to give 3 times or 4 times. By IV, we can give just 1/10 only and it will have impact. I hope that helps you to understand that, Shilpa ji.
Yeah, doctor. And lastly, I would like to request you people, please conduct this kind of Zoom meetings, because most of the people, though he is an software engineer, though he is a real estate person, though he is very good politician, we are having very minimal knowledge about the medicine and about the doctors when compared to the other countries. So I request you people to conduct these kind of Zoom meetings, so that at least we will be having what actually is going in our body, what we have to do, that little minimum knowledge we may gain through this kind of meetings. This is my request.
Definitely, Shilpa ji, keep electing great and blessed president like Chetna Bhatia ji, and keep supporting with participation by sharing these videos. I am very much sure we all are like dibbas who will follow whatever the president ji does. She reached out to us, and we are here only and only on her guidance. So it's all
Okay.
about leadership. It's all about doing the our bit for our society.
Okay. Thank you so much, doctor, for uh, for having patience and giving replies to my queries.
Absolutely an honor, Shilpa ji. Anybody else? Any other questions? Slightly time is running out, but we are very much keen to address if there is any doubts.
I think nobody wants to ask any further questions. So,
If you give me an opportunity, Chetna ji, probably I would want to steal 5 minutes. If Vijay wants to quit, it's fine, because we've had a 14 years old gentleman boy who died with a heart attack 2 days back. We've had 2 pilots who lost their lives in last 24 hours. Heart attacks are taking a big toll in our society. I would want you to remember A, B, C, D, E. Number one is A. Please, everybody do the HbA1c test if there is a doubt that you have a diabetes or if you have a diabetes. A1c every 3 months, please do it. Check your BP and regularly. You know, C is for cholesterol. Please check cholesterol as well as CRP and creatinine. These 3 tests whenever it's needed, at least once in 100 days. D is please do the test called as D dimer, and E is for the ECG and 2D echo. We need to do these tests again and again. So please remember, कल ही तो किया था, last week तो किया था, दोबारा जरूरत नहीं है. Ausrama. This is a reason for people dying young, and we feel uncomfortable. We cannot tell you openly the person with whom you have done the investigations. We are doubting whether this report is correct or not correct. You do not know probably the investigation, say 2D echo can be done by technician without you knowing it, that it is done by the consultant himself or herself. So please remember, I have given it on the chat box. A, B, C, D, E, and finally F is for family physician. Reach out to me or to your doctor before it is too late. Go to a doctor when you do not need him, and you will never need him. Every 100 days you should have these investigations done. If right now any one of you think that you have some symptoms and you may require investigations, please do it. Keep doing the investigation. Maybe keep changing the labs whenever you have a doubt. No lab in the earth is 100% safe and sure. If yesterday investigations done, today your doctor says, please repeat it. For heaven's sake, don't doubt him and say he is making money, 30% cut and all that nonsense. Doctors, 30-40% cut is not important than your life. If you have by any chance a doubt about a doctor, go to another doctor. But again, do not give the leading questions to your doctor. Doctor will say yes to whatever you want to hear. If you go back to him, take his opinion, and if you have any doubt, I'll be very happy to help you out in any given situation. My number is being shared here 24/7, even night 2 o'clock also. You can WhatsApp me, and I will be there to help you out. I hope this message will help you and me to keep our society heart attack free. It can be done. It's just that key we have to have reaching out to the doctor in the right time without complications. With these few words, I thought because of so many deaths and young people getting heart attacks, it has kind of become messed. Say the young boy who died yesterday in Khammam, 14 years old boy died. Say when I asked at least 10 of my cardiologists, everybody said there is no possibility that the child did not have a chest pain or other symptoms. Now, if we tell 14 years old boy 2D echo, immediately, यार ये तो commercial doctor है. 14 साल के बच्चे को 2D echo लिख दिया. साहब, and remember one thing, when we do the 2D echo for 1,000 children, it will be abnormal in one child. In 999 people will still think they have gone to a commercial doctor. For heaven's sake, please do not question your doctor. He only thinks good for you, and that's the only message with a folded hand. So I can tell it to you so that you can get the right message. I hope that should be enough for you all. Sorry for barging in my medical heart attack story because I was uncomfortable. 2 pilots died. They're 40 years of age. Young boy of 14 years old died. Sai Chand, 39 years of age, gentleman died. KK, with so much of thousands and crores of money, he died while performing in the stage. The only thing is they doubted the doctor. They thought they were smarter than the doctor themselves. So that gives us a bad taste.
आशीष, डॉक्टर आशीष चौहान जी, आपका बीच में आकर बोलना थैंक यू। ये एक स्पेशल आपने थोड़ा बताया है, हमने भी वो न्यूज देखी थी, बहुत दुख हुआ था। कल ही तो आई थी वो पायलट्स की न्यूज। तो अच्छा है, आप लोगों से हम कंटिन्यूअस टच में रहेंगे तो हम लोगों को नॉलेज मिलती रहेगी। नॉलेज तो एक्चुअली सबको होती है, बट मेन प्रॉब्लम है कि हम लोग उसको फॉलो नहीं करते हैं, और थोड़ा रिन्यू होती रहेगी तो थोड़ा माइंड में फ्रेश रहती है वो सब चीजें। और थैंक यू डॉक्टर सो मच विजय करण रेड्डी जी for your new and valuable information about child cancer and other cancers. So now I would like to invite second VDG, Sairam Raju ji, for his observation.
Ma'am, there is no any specific observation, but as very rightly, said by Dr. Ashish, awareness is very important. And though even the crowd is less, that doesn't put our morale down, but still आपने conduct करा उसे, that is very important. And I wish, we would have informed this to many other groups. तो ये अच्छा रहता था, but I really appreciate the efforts that, you have made to call this both the doctors, and wholeheartedly, I really feel blessed. Such an eminent doctor, Dr. Ashish Chauhan and Kiran Reddy साहब, आपने वक्त निकाला, irrespective of the audience, that has not demeaned your sharing the information with the people. That is something which is very, very appreciable. And I really thank behalf of the entire district that, you have took a very valuable time and you have given us this very useful information and the knowledge. Thank you so much.
Thank you, Sairam Rajuji. I would like to call District GLT Challa Srinivas Reddy ji if he wants to say something. So,
thank you, madam, giving me the opportunity.
Thank you, sir.
As usual, Dr. Chauhan ji and Vijay Karan are giving awareness for all of us. It's rightly appreciate to you, madam, to conduct organizing this Zoom meeting. Hopefully all are aware about it. Thank you, madam. Thank you, Chauhan ji, Dr. Vijay Karan Reddy sir. Thank you, madam.
Thank you, sir.
Thank you, sir. So I want to invite Madhumita Bhattacharya, FWC, for her observation on behalf of all the guests.
Thank you, Dr. Ashish Chauhan and Dr. Karan, for taking us through a wonderful, not a wonderful journey, but an awareness journey of cancer. And as our second Vice District Governor said, it would definitely be nicer if more people attended. Where will the awareness come if the number of people attend are less? I think we, in the urban, we've done enough. We have to slowly move on as Lions to the rural. We have to spread awareness there itself, because unless we spread awareness, our cancer is not going to come down, the cancer is going to increase. And what I feel, I just have a thing that which is not out of the box from here, that our pharma research should increase more, because even when we make the rural aware, the problem that comes in treatment of cancer is the cost, the financial cost. And we cannot bring it down until we have drugs in India. I'm sure both Dr. Kiran and Dr. Ashish Chauhan will agree with me. There are very few drugs available. Very expensive are the treatment of cancer. So we have to help out, or not only in awareness, but also financially, if it comes to that. That is how we can move ahead. Congratulations. Yes, Shilpa, you were saying that we should have more awareness. If we have more awareness, I think there should be more people attending.
Yes, ma'am. Yes, ma'am. Gradually,
Yeah, thank you, Chetna ji, for arranging this talk. But we will, next time, whenever we arrange, we will see that we reach out to many more of the walls, that is in the WhatsApp wall, so that everybody knows about it. And then we get a bigger crowd. And then, yes, this is all what we can do for urban, but we have to do something for rural also, because one of our main agenda of services in our Lions is cancer awareness. And this cancer awareness should childhood cancer awareness, which should reach out to the rural people. Anyway, thank you so much, Dr. Ashish Chauhan, Dr. Kiran, and Dr. Garima for steering the entire program. Thank you so much. Without, such programs will lead to more awareness. And we can talk to people more about what we heard now today. We can talk to others in simple language. Thank you, everyone.
Thank you so much, Madhumita ji. Now, on behalf of all my club and all, I would like to give the vote of thanks by myself. So, thank you so much, Dr. Vijay Karan Reddy, Dr. Ashish Chauhan, for taking time out of your busy schedule. I would like to thank Dr. Garima for from Here and Say Clinic for helping us in conducting this Zoom meeting. And I would like to thank the GAT area vice leader, Lion Deepak Bhattacharya, for his presence. I would like to thank first VDG, I think he was there in meeting, Lion Rajendra Prasad ji, and second VDG, Lion Sairam Raju ji, for gracing the occasion and for encouraging us. I would like to thank other dignitaries also for their presence and encouraging us. And thank you each and everyone. Thank you so much. Thank you, sir.
Thank you, ma'am. We shall close the meeting.
Thank you so much.
Thank you so much. Thank you.
Thank you, doctors, for your support.
Thank you.